Assignment 6, interviewing a health educator. This is Jasmine Taylor, and I've chosen to interview Natalie Klein for this assignment. Who is Natalie Klein? Natalie Klein has been a level 2 health educator for the last 3 years, and she's been with South Central Foundation for almost 14 years, and has been working in the field of health education for the last 20 years. She's done this through various facilities or various fitness facilities in different positions around town. She was once a coordinator at Body Tech. She was an assistant director at YMCA. She was adjunct faculty for UAA, and she taught circuit training, kickboxing, and step aerobics. And she had her own business, Tailored Body, that specialized in health education. And she has also served as a doula. Who is Natalie Klein continued? Her educational background includes a Bachelor of Arts in Health Service Administration from APU and Associates of Arts from UAA. She's also a personal trainer and a group exercise instructor. She teaches Zumba, Zumbini, Pyo, strength training, and other various classes. She's also an aquatics instructor, a kickboxing instructor, a certified childbirth educator, a tobacco treatment specialist, a lactation education specialist, and a licensed advanced massage practitioner. Why did you get into health education? She was a young mother with limited skills. She had 3 children before she was 22. She also had a family that was full of health issues. By the time that she was pregnant, her dad had already had 3 heart attacks and a triple bypass, and he was only 41. Her grandfather had also died of a heart attack at 51, so heart issues were a big problem in the entire family. And so she took the initiative to learn as much as she could to make sure that her children were healthy, with classes on how to properly breastfeed, and she also tried to instill in her children an active lifestyle after having a lot of her family live a sedentary lifestyle, as she was from a rural community in the Yukon in Canada. What do you do? Her job includes breast and cervical cancer outreach, tobacco cessation, with local and rural outreach at several villages in Southeast Alaska, Southeast Alaska. Childbirth and lactation education, Zumbini for customer owners, employees, and family at SCF, and Bright Beginnings Daycare, and she has 90 students monthly just at the daycare. Zumbini is Zumba for children 1 to 3. She also does village health fairs in the spring and fall. They recently added Soldovia and Old Harbor to their current list. She's a presenter at Core Concepts, which is a training program at SCF, the NUCA conference, which is South Central Foundation's model for the where they present healthcare, and it's a global and world-known program. People come here from all over the world just to see how they run their hospital, as well as IHI. She also holds cancer support groups. She also teaches group exercise classes and does group exercise facilitation for teens and youth at places like the Heritage Center, the Pathway Home, therapeutic group homes like Dina Coy or Ernie Turner. She's presented at multiple local corporations on various health-related subjects. She's also previously been a co-facilitator for Lose to Win, which is a weight loss program. They conduct lipid panels, blood glucose levels, cholesterol, and baseline measurements for their customer owners. And she grew the group fitness courses that were offered. So when she first started in the health education department, there was only one group fitness class that was offered by one person, and she she had already been certified in a bunch of different programs like kickboxing and step aerobics, and she was actually the first certified Zumba instructor in Anchorage, and really just got the ball rolling on expanding the courses offered at South Central Foundation's Wellness Center. Challenges to her job. There's limited staff and time. She said that there's so much work to do, and there's so many elements of health that with the limited people, she feels that they can only be adequate at everything as opposed to having their own individual specialties or being experts on certain topics. And it's just really hard to cover what they would like to. She has a personal challenge with the tobacco cessation program because even though their success rate is high compared to other programs at 20%, she she has a hard time doing it because she has a hard time doing it because she's working with people in a way where she's taking something that they love away from them, and so she's working with sort of unhappy people because they're having an addiction taken away from them, as opposed to other parts of health education like exercise instruction or childbirth or lactation education where she's adding something to their lives and she feels like she's making them happy and bringing them joy. She's also a natural helper and has trouble so she has trouble not taking her work home or staying late at work, and she just she struggles with balancing. A final problem is communication within the system. South Central Foundation, their primary care center serves not just local Anchorage people, but also customer owners from all over all over Alaska. They come in and get their care at the PCC, our primary care center, and they don't. There's such a lack of communication that they don't even know that there's a health education and wellness center, so they don't know about the resources that are available to them. And it's hard to transmit or let people know about that information when they live in rural villages, and a lot of the villages they don't even have internet access, so it's just a work in progress. Any career advice? She says to specialize. She also says to never stop learning, especially in health education, because there's always more to learn. And I asked her if she used any health education theories or models in her work, and she mentioned that they use material from the CDC that has been created using various models, such as the logic model or the health belief model, but their current the current SCF health educators don't have degrees in health education. It's at least at UA, it's a fairly new degree track, and they didn't even know it was a degree until I interned there last summer, and they were like, "Whoa, that's a degree!" But people there have either social work degrees, health administration, or physical or PE degrees, things of that nature. So after explaining a little bit of the models to her, she said that they're probably using these models or components of them. They're just not actively aware that they're doing it. I mentioned NUCA as it's a big part of what they do, which is the system of healthcare that South Central Foundation uses, and it's about making relationships with people, including their families, and making everything culturally appropriate. So it kind of falls back on the health belief model, just making sure to customize everything. And that's about it. Thanks for listening to my presentation.